One of the very important things we do for our patients is to look for acute stress reactions, or something that might be called post-traumatic stress disorder. This term was originally phrased by psychologists who studied Vietnam veterans coming back from that terrible, terrible war so many years ago. We've all heard stories about people coming back from that war or other traumatic experiences of a similar nature where they have responses where they believe even months, years, or decades later that they're right back in Vietnam again, they're holding onto that rifle, they're sweating bullets, and they're scared to death because it's happening to them right now. What we understand about a lot of our acute stress reactions, and that's part of one of the irritants we must identify and remove in our phase 1 treatment to identify, correct, and remove irritants, is definitely acute stress reactions. The post-traumatic stress disorder is a time reference of the brain. Let me explain that best I can. We can have a memory of something that happened to us some months or even decades ago and reference that memory and talk about it in a calm fashion when our brain is remembering it as a memory. If we have post-traumatic stress disorder, our brain will reference that event of years ago and we will think we're right back in it right now. Again, the Vietnam veteran thinks he's back in Vietnam even though he's sitting in his nice, warm, comfortable home and a nice, quiet day in suburban USA. His brain goes back and makes it think that that era is now present. So we need to help the brain differentiate between what's happening to us right now and what happened to us back then. And the things that happened to us back then, we want to reference as a memory, and the things that happen to us now, we want to have a reaction about. I live in northern Michigan. We have both bears and cougars in the woods out here. If I'm out in the woods some afternoon looking for nuts and berries to have for lunch, and a bear comes along or a cougar comes along, I need to plug in all of my adrenal response stress reactors as fast and as quick as I can, because the condition is called fight or flight. I'm not going to fight the bear or the cougar, I'm going to run. If I run far enough and fast enough, the bear or the cougar gets bored and leaves me alone. I need that acute stress response when it's happening to me right now. When I'm thinking of an auto accident, I remember when the red car hit me on the side of the car, on the passenger side, in an accident 10 years ago. I don't need that acute stress response right now. I can talk about the accident with the red car and have it as a memory, not an emotional charge. So the work with the psychologists first came out under the name of EMDR. This stands for eye motion desensitization reprogramming. They're using motion of the eyes up and down and back and forth and round in circles in different directions to help reprogram the brain to think of the occurrence that this person had is a memory that they can talk about calmly and not carry the emotional charge with. And once we can separate that in the brain, and the brain can remember that event as a memory, we no longer have post-traumatic stress disorder. It's not happening to us right now. I'm not back in Vietnam, and the red car did not hit me 5 or 10 seconds ago. I do not have to have an emotional charge associated with that. Our applied kinesiology muscle response testing has allowed us to use muscle testing to determine which eye motions we need to use to correct the patient's post-traumatic stress. The theory is that most all the things that come into our cortex, into our brain as a memory, are often visual. Many, many, many things we have in our memory came in through our visual field, through our eyes, and are programmed in our brain by a visual memory. So wherever our eyes were, when the car hit me, the red car hit me, I was looking to the left, looking to the left, looking to the left. So when I do my eye motion desensitization treatment on my patient, we may have to go through eye motion therapy where that patient goes eyes to the left 5, 6, 8, 10, or 12 times to reprogram the brain to remember the auto accident was a past memory. The red car is not hitting me right now. And we'll demonstrate some of this in just a moment. Okay, in our history of our patient Lauren here today, she was telling me about her experience with the auto accident that has given her a mild case of post-traumatic stress disorder. She shared with me that she was driving down the road at a normal speed and she glanced over to the left and saw the red car coming at her at a very high rate of speed, and realizing she may not be able to stop and avoid a collision with this red car. So her eyes kept glancing to the left, to the left, to the left. The red car just then hit her in the side of her car, causing quite a collision and quite a reaction. So at this time, we're going to go through some eye motions here and see if we can help negate the terrible effects of that emotion, of that auto accident, so her brain can remember it as a memory, so every time she sees a red car to her left, she doesn't go into the panic or the adrenal stress response of being back in Vietnam or being back in an auto accident, so to speak. Okay, I'm going to test your muscle here and hold. I want you to look your eyes all the way up towards me. Hold. Look your eyes all the way down towards your feet. I want you to look your eyes all the way left, and that gives us a weak response. I want you to look your eyes all the way right. And let's go with eyes down to the left, eyes up to the right, eyes down to the right, eyes up to the left. We're now going to circle with your eyes around. Let's go right, top, left, down. Hold. Let's go left, top, right, down. Hold. Now the term is bug eyes. Imagine you can bug your eyes forward like you're looking up past the ceiling up there. And hold. Now imagine the muscles could pull your eyes back into your head as if you could suck them back in. And hold. Okay. In today's example, we found one weakness when Lauren was looking her eyes to the left, and this was an incident where she was again thinking of the auto accident and looking eyes to the left. So now we want to negate the weakness here and bring strength back to this procedure and help her body and her brain determine that this time, this incident when the red car ran into her vehicle, it's a memory she can talk about calmly, not something that has an emotional charge. The red car is not hitting her car right now. So, eyes to the left, please. We're going to ask out loud, how many times we can do this eye motion therapy to negate this weakness? 1 time, 2 times, 3 times, 4 times, 5 times, back and forth. So you can rest your arm down. I'm going to have you go through some eye motion. You're going to follow my finger. While you're thinking of that red car on your left side hitting your car, I want you to go back and forth with your eyes. Let's go eyes left and right, and left and right, and left and right, and left and right, and left and right. Arm up near, please, and hold. Let's have your eyes go all the way to the left. Hold. Let's have you again think about the memory of having the red car run into your car, and look your eyes to the left, and hold. We no longer have a weakness relative to this memory. So our brain should now have a much better opportunity to allow that auto accident to be a memory that does not carry emotional charge, and every time she looks to the left and sees a red car, she does not have to go into a panic and anxiety or emotional response or an adrenal response, as we call it, or what we call the fight or flight system. It could just be a memory. Now that we've demonstrated some of the eye motion therapy for emotional release work, I'd like to share with you a little bit of my experiences. I have done these treatments on hundreds of patients over the last 12 years, and I've seen some very, very dramatic responses. But one of the things I've observed is the motion of the eyes that causes the weakness often tells us a little bit about what that person has been through. For example, if we do the eye motion therapy, ask the patient look all the way up to the top, and we get a weakness in that position, I often think this has to do with possibly a spiritual type situation. This person may be not in touch with their own spirituality, they may be mad at God, or any other way you want to describe something where they don't feel centered in this part of their life. If we have the patient lift their eyes all the way to the floor and we get a weak response that way, I think this might be what I'd call a downer or a depressive type of emotional response this patient's having. If we look our eyes all the way left or all the way right or up to the left or down to the right and get a weakness, this is usually the position that the patient's eyes were in when the traumatic experience happened. We reference the idea of an auto accident where a red automobile coming at us from the left side. That patient will require movement to the left over and over again to correct their imbalances. One of the other positions we do is eyes in a circle. Start at the top, go eyes all the way around one way and all the way around the other way. In this reference, we find the weakness response for the emotional experience often relates to things that happen around us as individuals, not things that happen within ourselves that we feel personally responsible for, maybe something that we could not change or do anything about, but something around us happened to us that really affected us emotionally. And then the last two positions we talk about are bugging eyes forward, where you're looking, as I say, past the ceiling, up at the roof, so to speak. This is future vision. And the last position is having the eyes pulled back into the head as if we could suck them back in with those muscles, and this has to do with past vision. If we're dealing with post-traumatic disorder of an abusive situation, happened to us as a child, we're going to find that in the eyes back past situation. If a person is very much concerned about their immediate future because of finances, job, or relationship, something that's very stressful, we have them bug their eyes forward, we get a weakness in that response. So as we go through these treatments and therapies, I often tell the patient, here's what I've observed with the weakness response and the treatment we've done. How does this fit for you? Does this feel like something that happened when you were looking to the left? Does this remind you of something that happened around you, not necessarily with you? Does this relate to you in a situation that is really your future you're concerned about? Or does this relate to you in a situation that was past vision or eyes backwards that brought out this weakness? They almost always can relate to the situation that we're helping them to correct post-traumatic stress disorder much more clearly, much more vividly, once the body helps us understand what phase of their emotions and what experience of their emotions we have to balance at this time.